Welcome to Psychology Insights Explained, or PIE. And here's a slice of pie. In today's slice, we are going to talk about Oppositional Defiant Disorder, or ODD. It's a challenge many parents face dealing with a child who just won't listen. You ask your kid to clean their room and they erupt in a fiery explosion of no. You set a reasonable curfew, and it's a battle royale just to get them home on time. Homework? Chores? Forget about it. It's like they've made it their personal mission to push every single one of your buttons. You start questioning your parenting skills, your sanity, even your ability to make a simple sandwich without a meltdown in the background. But what if I told you that behind those defiant eyes and that mountain of attitude, there might be something else going on? What if those constant battles weren't just a phase or a personality quirk, but a sign of a deeper issue? We're going to dive deep into the world of Oppositional Defiant Disorder, or ODD. This is about understanding. It's about recognizing the signs, separating the myth from the reality, and most importantly, equipping you, the parents, with the tools and knowledge to navigate this challenging terrain. We'll talk about what ODD really is, how to tell if your child might be dealing with it, and what you can do to help. Because knowledge is power, and when it comes to our kids, we can never have too much of that. We're going to untangle the complexities of ODD, shed some light on this often misunderstood disorder, and empower you to create a more peaceful, loving, and supportive environment for your child and for your entire family. All right, let's cut to the chase. What exactly are we talking about when we say oppositional defiant disorder? Well, it's not just about kids being stubborn or strong-willed, although those can be factors. ODD is a recognized mental health disorder, and it's characterized by a persistent pattern of angry, irritable mood, argumentative and defiant behavior, and vindictiveness. These kids aren't just pushing your buttons. They're struggling with their own emotions and behaviors in a way that causes significant distress for themselves and everyone around them. With ODD, it's not just a once-in-a-blue-moon blow-up. We're talking about a consistent, ongoing pattern of defiance that goes beyond the typical ups and downs of childhood. These kids aren't just testing boundaries, they're actively challenging authority figures, whether it's parents, teachers, or other adults in their lives. So, how do you know if it's just a phase or something more serious? Kids with ODD often exhibit a cluster of specific behaviors that go beyond the pale of typical childhood defiance. They're constantly arguing with adults, refusing to comply with requests or rules, deliberately annoying others, and blaming everyone else for their own mistakes. These kids are masters of the emotional landmine. They're easily annoyed and angered, often holding grudges and seeking revenge for perceived wrongs. The key here is to recognize the overall pattern of defiance, anger, and vindictiveness that disrupts their daily lives and the lives of those around them. One more thing to keep in mind. Age matters. ODD can emerge at different stages of development, and the way it presents can vary depending on the child's age. In younger children, you might see more frequent temper tantrums, extreme difficulty sharing toys, and a constant need to have things their way. As kids get older, those behaviors might evolve into more verbal defiance, arguing back and challenging authority figures. Teenagers with ODD might engage in risky behaviors, skip school, or experiment with drugs or alcohol. Regardless of the age of onset or the specific behaviors, the common thread is that chronic pattern of defiance and negativity that impacts the child's relationships, school performance, and overall well-being. Now let's get real for a minute. Every kid pushes boundaries. It's part of growing up, testing the waters, figuring out where the lines are. But with ODD, it goes beyond the occasional tantrum or argument. So how do you tell the difference? How do you know if your child's behavior is just a phase or if it's something more? First off, look at the frequency and intensity of the behavior. Is your child defiant and argumentative almost every day, multiple times a day? Are their outbursts extreme and difficult to manage? And finally, pay attention to the impact of their behavior. Is it causing significant disruption at home, at school, or in their social life? Is it affecting their academic performance, their relationships, or their overall well-being? Now, ODD doesn't just magically disappear when your child walks out the door. It can show up in different ways depending on the setting. At home, it might be constant arguments, refusal to follow rules, or deliberate attempts to annoy siblings. Homework becomes a battlefield. Bedtime is a nightly showdown, and even simple requests are met with resistance. At school, ODD can manifest as difficulty following instructions, talking back to teachers, or disrupting the classroom. These kids might have trouble making and keeping friends, and their academic performance can suffer due to their defiance and lack of cooperation. ODD can rear its head in social situations, making it tough for these kids to navigate playdates, extracurricular activities, or family gatherings. They might have trouble controlling their anger, lashing out at others, or refusing to participate. The key takeaway here is that ODD is pervasive. It's not confined to one setting or relationship. It's a pattern of behavior that can impact every aspect of a child's life, making it crucial to address it head-on with understanding, support, and effective strategies. Now, behind that tough exterior, those angry outbursts, and that constant defiance, there's a child who's hurting. Kids with ODD aren't trying to make your life miserable, though it might feel that way sometimes. They're struggling with their own emotions and behaviors in a way that feels overwhelming and out of control. Imagine being stuck on a roller coaster of anger, frustration, and resentment. This constant state of emotional dysregulation can take a toll. Kids with ODD are more likely to experience anxiety, depression, and low self-esteem. They might struggle with peer rejection, feeling like nobody understands them or wants to be their friend. And the more they act out, the more negative feedback they receive, creating a vicious cycle of defiance, anger, and isolation. It's important to remember that ODD is not a choice. It's a complex disorder influenced by a combination of genetic, environmental, and biological factors. These kids aren't giving you a hard time because they want to. They're having a hard time. So what causes ODD? Well, folks, it's not as simple as pointing the finger at one single factor. It's like a puzzle with multiple pieces contributing to the bigger picture. We've got genetics, brain chemistry, environmental influences. It's a whole cocktail of nature and nurture that shapes these kids' behavior. Some kids are just wired differently. They might have a lower threshold for frustration, a hair-triggered temper, or a hard time regulating their emotions. These inherent traits, often passed down through families, can make them more susceptible to developing ODD. But hold on, it's not just about genes. Our environment plays a huge role too. A chaotic home life, inconsistent discipline, or exposure to trauma can all increase a child's risk of developing ODD. The good news is, understanding these underlying causes can help us develop more effective strategies for managing ODD. It's not about blaming parents or labeling kids, it's about recognizing the complex interplay of factors that contribute to this disorder and working together to create positive change. Now, let's get down to the nitty-gritty of what's happening inside the brains of kids with ODD. Research suggests that differences in brain structure and function might play a role in their emotional reactivity and behavioral control. One area of the brain that's often implicated in ODD is the prefrontal cortex, the part responsible for planning, decision-making, and impulse control. In kids with ODD, this CEO might be taking a long lunch break, leading to impulsive decisions, poor judgment, and difficulty thinking through consequences. Another key player is the amygdala, the brain's alarm system, constantly scanning for threats and triggering the fight-or-flight response. For kids with ODD, this alarm system might be on high alert, misinterpreting neutral situations as threatening and leading to exaggerated emotional responses. These neurological differences don't mean these kids are broken or beyond help. Understanding these underlying mechanisms can guide us towards interventions that target these specific areas, such as therapy focused on emotional regulation and impulse control techniques. It's about giving them the tools they need to rewire those circuits and regain control over their reactions. Just like a plant needs the right soil and sunlight to flourish, kids need a stable, nurturing environment to develop healthy emotional and behavioral patterns. A chaotic home life with constant conflict, inconsistent parenting styles, or a lack of clear boundaries can leave kids feeling insecure, anxious, and unsure of what to expect. Exposure to trauma, such as abuse, neglect, or witnessing violence, can also increase a child's risk of developing ODD. Trauma can leave deep emotional scars, making it difficult for kids to trust adults, regulate their emotions, and cope with stress in healthy ways. The good news is, even in the face of environmental challenges, there's hope. Creating a structured, supportive environment with clear expectations, consistent discipline, and plenty of love and encouragement can make a world of difference. While we can't predict with certainty which kids will develop ODD, there are certain risk factors that can increase the likelihood. Think of these as red flags, warning signs that might indicate a need for early intervention and support. Some risk factors are related to the child themselves, such as a family history of mental health disorders, being born prematurely, or experiencing complications during birth. Other risk factors are environmental, such as poverty, exposure to violence, or having a parent with a substance abuse disorder. These stressors can create toxic environments that hinder healthy development and make it harder for kids to cope with adversity. Recognizing these red flags early on allows us to intervene proactively. providing resources, therapy, and parenting strategies that can help mitigate these risks and promote healthy development. No parent wants to hear that their child might have a mental health disorder. It's scary and confusing. Early diagnosis and intervention are crucial. The sooner we address these patterns, the better the outcomes. So, when is it time to call in the professionals? If your child's behavior is consistently disruptive, causing significant distress, impacting their academic performance or relationships, those are red flags to seek professional help. Early intervention helps kids develop healthier coping mechanisms. Seeking help means you're advocating for your child's well-being. Criteria for an ODD diagnosis. How do professionals diagnose ODD? It's based on observations, interviews, and the DSM-5. The Diagnostic and Statistical Manual of Mental Disorders, DSM, is the handbook used by healthcare professionals as the authoritative guide to the diagnosing mental disorders. The DSM-5 lists specific symptoms and criteria. Symptoms include angry mood, defiant behavior, and vindictiveness. These must last at least 6 months and cause significant distress in social, academic, or occupational functioning. Differentiating ODD from other conditions. ODD often overlaps with other conditions, making it important to differentiate between them. One common imposter is ADHD. ADHD-driven defiance is due to impulsivity, not a desire to oppose authority. Conduct disorder also mimics ODD but involves severe behaviors like aggression and theft. Seek a comprehensive evaluation to rule out other conditions and get an accurate diagnosis. Okay, folks, so you've got a diagnosis. Now what? Treatment for ODD can feel like navigating a maze. But here's the good news. You don't have to go it alone. A qualified mental health professional can help you develop a personalized treatment plan. There's no one-size-fits-all solution. What works for one child might not work for another. Treatment often involves a multifaceted approach. Now let's delve into the world of therapy for ODD. Therapy for ODD equips kids with tools to manage emotions and build healthier relationships. Cognitive behavioral therapy, or CBT, is particularly effective. It helps kids replace negative thoughts with positive ones. And with the right therapist, therapy can be a game changer for kids with ODD. Therapy is a cornerstone of ODD treatment, but it's not the only piece of the puzzle. A holistic approach can make a world of difference. Think of it like a garden. Nurture the soil, provide sunlight and water, create a structured and supportive home environment, establish clear expectations, rules, and consequences. Consistency is key. Kids need predictability and routine. Encourage healthy communication and be an active listener. Focus on problem-solving together. Remember, you're on the same team. Use positive reinforcement and praise their efforts. Celebrate their successes and build self-esteem. Ensure they get enough sleep, eat well, and stay active. Managing ODD is a marathon, not a sprint. It takes patience, persistence, and love, and with the right approach, you can help your child thrive. Look, folks, dealing with ODD is tough. It's emotionally draining, it's physically exhausting, and it can test even the most patient parent. But here's the thing, you're not alone. Millions of families face these challenges, and there is hope. With the right knowledge, support, and a whole lot of love, you can navigate this journey and help your child thrive. Remember, ODD is not a life sentence. It's a challenge, yes, but it's also an opportunity for growth, both for your child and for your family as a whole. By understanding the underlying causes of ODD, recognizing the triggers, and implementing effective strategies, you can create a more positive and supportive environment where your child feels understood, valued, and empowered to make positive changes. Don't be afraid to ask for help. Reach out to therapists, counselors, support groups, and other families who understand what you're going through. Remember, it takes a village to raise a child, and it takes an even stronger village to support a child with ODD. So, be patient, be persistent, and never give up on your child. With your unwavering love, guidance, and a commitment to understanding and addressing their needs, you can help your child overcome the challenges of ODD and reach their full potential. Thank you for joining us today to discuss Oppositional Defiant Disorder. Be sure to subscribe to this channel and hit the like button. Together we can make a difference. This has been Psychology Insights Explained.